You touched on sort of the new model of delivering cancer care requires customization and a lot of time of clinicians and the teams, and therefore resources of different folks like navigators and such. I guess the question is whether the reimbursement landscape is changing to support that. We know there are changes in reimbursement. CMS has what they call the oncology care model, and in other areas of healthcare, we have accountable care organizations and payment reform. So I'm wondering if you might talk about, how, if and how healthcare payment is kind of sort of flowing with the way delivery system redesign and patient care needs to happen.
Yeah, well, so my opinion is that it's moving in the right direction, and so, but it's not quite keeping up as quick as it should be. And there are a number of different models. As you're well aware, we used to have a very basic fee-for-service model where I would see a patient, and depending upon how long or how much I did for that patient for that encounter, I would be reimbursed a certain amount. And that's changed so that, now we have people who've talked about the term bundling, where they're, somebody with a cancer, the provider would receive a set amount of money to care for that patient, and that's good. Potentially, it can be bad because depending how much money it is, especially with all these new drugs that we've talked about, can be a disincentive for providing top care. But then one can take it a step further, and that's where it's providing these enhanced delivery approaches, where in addition to simply, a single provider getting a bundle of funds to take care of that patient, that amount is really intended to cover all areas of medicine that touch that patient. Mm-hmm. And that's then all of a sudden really requires somebody coordinating how exactly they're going to do this. I think it's a healthy process that we're going through right now. I think it remains to be seen as to which model is going to come out and work the best. As we started out early on discussing the unique features of our catchment area, again, the model that works best for rural patients might not be the one that works best for patients in a metropolitan area, where they can see all of their providers within a relatively, small radius of distance. It might differ depending upon the number of subspecialists and how far they are from medical centers. We know in central Pennsylvania that there are entire counties that have no primary care physicians and no hospitals and no screening facilities for cancer. Half of the counties don't have any place where patients can receive infusions of chemotherapy. So there really are going to be big differences. Mm-hmm. But I think overall, I think these new models are very, very interesting.
Mm-hmm. And so as director of a clinical enterprise, how much education or how important is it to educate providers at this stage on sort of these new payment models and how they're evolving, or just let them focus on patient-centered cancer care delivery and not worry about so much of those details? I imagine there's a fine line there.
I think there's a fine line, but again, my bias is that the providers really ought to learn about them, because those individuals, and you being one of them, that are putting these payment different approaches together, really need to hear from the providers in terms of what looks like it'll work and what won't, and what are the issues related to it. So I think when any of these plans are rolled out, and we really, as you mentioned, didn't talk about the oncology care model very much, which we're not yet participating in, but for us to do that, what I would hope is that we would give feedback to CMS in terms of how well it would work or not for what we're doing. And I'm very comfortable, at least from the various approaches that have been taken, that those providing those approaches are really wanting feedback from providers.
Right. Yeah, it's difficult to get it quite right, and so it's a class of feedback and iteration, hopefully, to get to the point where it's working perfectly.
Yep, exactly.
Good.